The patient is definitely getting the EUS fiducial in preparation for SBRT with our radiation oncologist colleague. But our medical oncologist actually asked for additional core samples because they wanted to run some NGS as well as some additional studies that they have because she's part of a clinical trial. So we're going to actually showcase 2 of the core needles that we currently have available on our unit. I think it looks like we're going to start with the Boston Scientific Acquire S.
Yeah, so this is a new needle, sharper than the older version.
In terms of suction, do you like slow pull? Do you like?
I always use slow pull.
Because there's some who actually use no suction, from what I understand. Is that correct? Yeah.
I don't know if the panel has a technique you prefer.
This is Uzma. I always do slow pull.
Yeah.
Well,
I just.
So in a randomized trial using the 2 FNB needles, in both cases, slow pull was favored over suction or no suction.
This is good and diagnostic for pancreatic adenocarcinoma, and now based on rows, we they are in right target and they can now proceed for the next steps.
So there you have it. It was a beautiful specimen. So the question is always, if you don't have on-site cytopathology, you can always look macroscopically. Tissue itself is tan, and you can see the nice core. Anytime you see red, it's usually stringy red, it's usually blood.
We switched over to the 22 gauge Expect FNA needle, and the fiducial that we're going to use today is called Lumacoil. It's from Boston Scientific. The diameter is 0.46 millimeters, and it's 5 millimeters in length. It's made of platinum, and as far as I understand, it's the only platinum fiducial marker that's on the market. So there's a fiducial that's in this plastic introducer, and what she does is hub the tip into the lure of the needle. All right. And then there is an introducer that you push into the center of the catheter. And what that does is actually push the fiducial into the lumen of the needle itself.
Do any of you guys routinely place these, or do you wait for radonc to ask? So you could tell it's kind of dependent on the institution. I'm just curious.
Well, we discussed that in the panel. This is purely a service situation. We don't do this independently. If the radiation oncologists call us, then we do it.